Today we're talking about small lumps under the skin. They can be worrying, even though most of the time they're harmless.
The people who come and see me with these things usually have two different sorts. One is a lipoma and the other is a cyst. They can vary from very small up to really quite large and bulky areas.
So if someone discovers they have a lipoma, does it always need to be removed?
It's usually very simple. Often these things can be done under a quick local anaesthetic and people can go back to work that day.
Most lumps under the skin aren't serious, but it's still worth getting them checked out.
Peace of mind is a perfectly good reason to come and own an opinion.
And how large can they get?
What?
Hi, and welcome to the Cutting Edge Plastic Surgery podcast. I'm joined again today by Dr. Adam Greenbaum, plastic and reconstructive surgeon. Today we're talking about something a lot of people notice, small lumps under the skin. They can be worrying, even though most of the time they're harmless. We'll talk about what these lumps actually are, when you can safely leave them, and when they might need to be removed. Adam, thanks for being here. So Adam, let's start simple. When somebody finds a lump under their skin, what could it be?
The people who come and see me with these things usually have two different sorts. One is a lipoma, which is a localized and usually benign lump fat, which is formed within the fatty layer under the skin, and the other is a cyst. And the common causes of cysts are blocked oil glands or leakages of fluid from the joints or the tendons that move the joints. These are called ganglions.
Where on the body do lipomas tend to form, and how large can they get?
Well, they can form anywhere where there's fatty tissue, and they can vary from very small and insignificant things that you notice quite by chance up to really quite large and bulky areas. And so anywhere that there's fat. The common places are on the torso, the arms, the legs, but they can occur on the forehead and in your cheeks, literally anywhere. But the common places are the torso, the arms, and the legs.
So if someone comes in for a checkup, what are the signs that tell you it might be a lipoma?
It's about the examination and the things it does compared with other structures that are similar. So with a lipoma, because it's in subcutaneous tissues, you would usually expect the skin to move over it. It's not completely ironclad rule, but generally speaking, it's within the fatty layer and it's palpably so. It could be fixed to the underlying fascia, but sometimes if they're forming within the deeper tissues, what you get is just a boggy swelling and you can't really tell and without having to image it.
So if someone discovers they have a lipoma, does it always need to be removed?
Not at all. It's mostly about symptoms. Occasionally, lipomas can become cancerous, and so there are some very specific questions and examination findings that I would elicit just to make sure that's not what's going on. But otherwise, it's about whether or not they're symptomatic.
You mentioned cysts earlier. How are they different from lipomas?
Well, cysts are fluid-filled sacs, and depending on where they've formed, again, they'll have very characteristic examination findings for the doctor who's examining them. But broadly speaking, if the cyst is formed from one of the structures within the skin, usually a hair follicle, and it's formed because an oil gland has become blocked, it moves with the skin and it has a characteristic feel. And you can often see the bit where the oil gland would usually have drained onto the skin, called a punctum. Whereas if the cyst is formed, a ganglion cyst, for example, from one of deeper structures, it will be sitting in that plane within the tissues, and so will again have a very characteristic presentation and examination.
Once a cyst or lipoma is removed, does it ever come back?
If it is done well, and the cyst and the lining and the lipoma and the capsule are removed intact, then that one shouldn't come back. It doesn't stop another one forming nearby. And there are people who do have tendencies to form multiple cysts or multiple lipomas, but those are relatively rare syndromes. But if there's a rupture of a cyst during removal, or some of the capsule is left behind, then there's still the ability for that to secrete, and so the cyst can form. And that's why it's so critical that these things are done by trained surgeons who know what they're doing and had experience at doing it.
If someone does decide to have one removed, maybe for peace of mind, what does that procedure look like?
It's usually very simple. There are times when surgery for ganglion cysts or for large lipomas or lipomas which are fixed to deeper structures would need to be done under a quick day case general anaesthetic, but often these things can be done under a quick local anaesthetic with a relatively small incision, and people can go back to work that day.
So to sum up, most lumps under the skin aren't serious, but it's still worth getting them checked out.
Absolutely. Most of these things are trivial, but it's really important to know which is which, and peace of mind is a perfectly good reason to come and have an opinion.
That's great advice. Thank you, Dr. Greenbaum.
Oh, it's my pleasure. These things are relatively easily sorted out, so come to cutting-edge plastic surgery, have a quick consultation. That sort of peace of mind is very easy to give you.
Thanks for tuning in to Lumps Under the Skin, when to leave them and when to remove them. We'll be back again soon with another episode from Cutting Edge Plastic Surgery.